Hi guys, my name is Julia and I'm going to be talking about what to expect at the hospital while you're in labor. So, as a doula, I've seen a lot of different births in the hospital, and the thing to know about birth is they're all very different. And so it's hard to know exactly what to expect. I don't ever know what to expect when I go to a birth, but I'm hoping to give you just kind of a baseline so that you know um, kind of a general idea of what might happen. And then if something different happens, you might have the tools to be flexible and kind of go from there. So the first decision that you're going to be making while you're in labor is when to go to the hospital. There's a lot of there's a lot of information on the internet. The 511 rule. There's a lot of different kind of guidelines for when to go. I like to keep it simple. And just when you start having painful contractions regularly, or your water breaks, just call your midwife or your doctor and check in with them, and they're going to let you know when to come in. Painful contraction is one that you're having trouble talking through, and so oftentimes on the phone, your doctor or midwife or nurse at the hospital, they're going to know kind of what's going on and they can give you some specific advice. And if you live far from the hospital or if you had a complicated pregnancy, then they might give you kind of more specific instructions based on your individual needs. Once you get to the hospital, you're going to head directly to labor and delivery. And so if it's super late at night, sometimes you have to go through the emergency room, and they'll direct you. And also just mentally prepare that your partner is probably going to be parking unless you park with them. And so you might have a couple of minutes by yourself. So just know that logistically, kind of think ahead and say, okay, this is what we're going to do, if it's really late at night, or, you know, how the parking's going to work. And then once you get to labor and delivery, the nurse is going to take you to triage. And triage is a room where the nurse is going to check out your baby, their heart rate, measure your contractions, and then they do a cervical check, which involves inserting a gloved hand into your vagina to check and see how dilated your cervix is. So when you're completely dilated and you're ready to push your baby out, you're going to be 10 centimeters. And throughout your labor, a nurse or doctor might be checking to see how dilated you are as you progress. Depending on how far along your labor is, you will be then admitted to labor and delivery from triage. If it's still a little bit too early, you might be sent home, and please don't feel discouraged if that happens. It's fairly common, especially for first-time moms, and you'll just come back after you're further along, and there's nothing to be embarrassed about or anything like that. Um, but if you are admitted to labor and delivery, then you're going to be sent to a room where you're going to spend your entire labor and deliver your baby. And then you'll stay there for, I think it's like 2 hours after your birth, and then you'll be moved to a postpartum room. As your nurse is kind of getting you settled into the delivery room, they'll have you put on a hospital gown if you want. They'll draw your blood, test your urine, to make sure everything's going well. And then they will hook you up to a fetal heart monitor. This is what that looks like. It's going to measure all these things are measuring your baby's heart rate, your heart rate, and your contractions. And then this person is also wearing a blood pressure cuff on their arm. And so every once in a while, it's like every half an hour, or depending on your pregnancy, you're going to get your blood pressure taken. So you can see it's a lot of wires kind of hooking you into machines, but you can see this person is standing near their bed, so they can have movement. But if you want to walk around, if you want more movement, just ask your nurse what your options are. There's usually a couple different options for that. And that kind of takes me to my next point, is to please ask questions. If you don't listen to anything else in this presentation, please remember this is your birth, and you are allowed to ask questions. And uh, the nurses, they have so much information. They are experts. They see so many labors and births, and so they're a wealth of information. And also, because they're seeing so many births, they have a routine that they like to follow. But if you have a different preference, you can ask, oh, is there an option to do something a little bit different? And they'll let you know. So, but they might not let you know if you don't ask. So really feel free to ask. Um, Also, throughout your labor, you are most likely going to be making decisions um, for yourself and your body and your baby. So the nurse might say, what I hear often is like, oh, maybe in an hour we can talk about breaking your water. And that can surprise folks if they're not sure exactly what they want. And so, some good questions to have in your back pocket are, what are the benefits and risks of that? Can you just like give me a little more information? Also, a good question is this an emergency or can I have some time to think about it? Oftentimes, it's not an emergency and you can kind of have time to just see how you're actually feeling about it and think things over. Two questions I also like are like, is it normal to feel this? Is it normal to feel like I need to push even though it's really early? Or um, what does that word mean? What does meconium mean? Things like that. Like, please do not feel like you should know everything about birth, and use the experts in the room to kind of get some information, and advocate for yourself and your body and your baby. As your labor progresses, it's probably going to be painful. Labor is painful for most people, not all people, but for most people. And just try to mentally kind of prepare and research ways that you might be dealing with this pain. There's different positions. You can have you know music or aromatherapy. People like different things. Even if you are planning on getting an epidural, just try to prepare some ways to manage your pain beforehand. If you are planning on getting an epidural, or even if you're not, just know that sometimes it can be an hour between when you ask for the epidural and when you get the pain relief. So, so know that. And then also doulas can be super helpful for managing that kind of pain. And if you're giving birth in the Mount Carmel Health System and you're on Medicaid, you can sign up for a doula for free at those hospitals. And if you don't have Medicaid, you can pay $300 for a doula, and they can be super helpful. And I'm biased because I am a doula, um, but they really can be. So once you're 10 centimeters, you are ready to push. The nurse will check you, and they might say, you're complete, you're 10 centimeters. You are probably going to be feeling a lot of intense pressure, um, really low in your body. And um, so the pushing phase, it can last a couple hours, especially if you're a first-time mom. It can be long. So the nurse is going to probably direct your pushing maybe a little bit before the doctor gets in. Um, they will have you usually lie in the bed and put your legs in the stirrups and kind of direct your breathing in conjunction with your pushing. A lot of times it's like, as you're having this contraction, take a cleansing breath and then breathe in and push, 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 push like you're going poop, and trying to go to the bathroom. And that's kind of what that usually looks like. And if you don't want to be coached, you can let the nurse know that. If you want different positions, you can also let those preferences be known. And then once you give birth and your baby's healthy, they'll be put on your chest for skin to skin. Um, that is the protocol at most hospitals. And if they don't do that, you can ask and check in beforehand and say, do you guys do skin to skin? If your baby needs like a little bit of attention after they're born, that can happen, and they might need to see the pediatrician before they can go on your chest, or if you've had a C-section. But you will get that time with your baby on your chest eventually, and it is a wonderful time. After that, your placenta will be born. People can get really shaky. They can feel like they have the chills, and so that's normal or common. And then some people feel like a lot of discomfort and cramping. Just try to focus on your baby. And then your partner or the staff can cut the umbilical cord. And then after that, it can kind of feel like a lot of things are going on um, because you have your baby and there might be a lot of people in the room. Their doctor or the midwife is also going to inspect you for tearing. Many women tear during birth, and so if you need stitches, they'll give those to you then. They might offer you pain medication, and just try to focus on your new baby. And it can be kind of uncomfortable, but know that that will pass. And if after that, if you feel like breastfeeding, go for it. It's great to start breastfeeding within the first hour, and the nurse can help you with that, or your doula. So that is my presentation. It's a great lead in to our next presentation, which we'll be posting on YouTube and is in person on the 6th of September. It's going to be about breastfeeding, and so you can get some tips for that. Thank you guys for listening, and I'll see you next time.